This is Going Under, Anesthesia Answered, with Dr. Brian Schmutzler and Vahid Sadrzadeh. We're brought to you by the Butterfly Network.
Which is not scary.
No, not at all.
All right.
If you're scared of needle and the needle out of plane thing, if you're a patient, but I don't know, not for us.
Not for us,
yes.
Right. All right, I'm going to let you in on something that's completely changed the way I practice. I've been using butterfly probes for years. It's a portable ultrasound that plugs right into my compatible smartphone or tablet, so I can start scanning at the bedside in seconds. If you have used the older versions, or even if you're new to handheld ultrasound, let me tell you why this new IQ3 is a game changer and really impressive. First off, having an ultrasound that literally fits in my pocket means I can move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty incredible. Biplane imaging lets me see short and long axis simultaneously. Huge for procedural guidance and honestly, a great tool for learners. The new needle out of plane preset even shifts the scan plane digitally so I can see the needle tip sooner, which makes a real difference when precision matters. And the image quality, honestly, the IQ3 holds up against some of the high-end cart systems I've used. That's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com.
Nice. Hold on.
Uh-oh.
Wait for it.
Uh-oh.
Wait for it. Of course, when I queued this up, it's not working.
Very scary. Very scary. Ooh, what is that? Is that a bat?
I don't know. I just got this off YouTube. Halloween Sounds of Horror.
Oh, my. Ooh.
I want to suck your blood. Yes. Well, we're talking all about scary stuff on this Halloween edition of Going Under, Anesthesia Answered. And one... Whoa!
And it won't stop. Oh, that's a witch for sure.
Yeah. One of those scary things is not anesthesia. Although a lot of people are scared of going under.
They are.
And that in itself could be...
a whole podcast.
A whole thing.
But it's very safe. So anesthesia, it's 1 in several million chance of having a really severe complication. So you're fine. Anesthesia's safe.
It's not a horror.
No, definitely not.
It's a joy. It's a joy.
Yeah, it's a joy.
So let's talk about monsters and diagnosing them for this Halloween podcast. So what exactly are we going to do so people at home who are following along or in your car or whatever it may be?
So the impetus behind this is I took a course in college called Monsters in Literature, which was awesome. We got to read all the classics, Beowulf, Dracula, Frankenstein, all those.
And this is at the university?
This is at the University of Notre Dame, correct. Yeah, and then...
do you remember your professor?
I knew you were going to ask me that question. I don't remember who the professor was.
It's okay. I was just testing.
He or she was very good.
Okay. Obviously, because you remember the class.
Yeah, so we wrote, papers about what does this say about society and all that sort of stuff. And then we got to watch the movies, too. And I love horror movies. I always have. So that was fun. So what we're going to do today, though, is we're going to take some of those classic monsters. Mm-hmm. We're going to diagnose them.
Okay.
Based on what medical condition I would think they have. And I used a few different resources. I dug up some stuff online. And then we're going to talk about how we would treat each one. So we'll do 5 today.
So we're not talking about like Winnie the Pooh and how there's like
no.
Each kind of thing with Winnie the Pooh.
No, we're talking about, so we'll start with Dracula.
Yeah.
So I have an actual diagnosis for Dracula, why he is the way he is.
Okay.
And then how we'd fix him.
And like how you diagnose them, correct?
Exactly.
Or is this what literature people think how we should diagnose them?
So it's a combination.
Okay.
I compiled several different sources to try to come up with these.
So do we have to, I feel like we have to have the sound effects for this podcast.
Do it.
Okay, so who are we starting
Dracula.
with?
We're starting with Dracula.
Okay, Dracula sound effect. Ooh, Dracula open music.
Ooh, nice.
Okay, here we go. Dracula resides in Transylvania.
He does, and he has to not come out at night, and he has to drink blood to stay alive, and he lives essentially forever. Though we won't talk about.
And he's allergic to garlic.
Yeah, that's not in here either. But
okay,
he is allergic to garlic.
Okay,
yeah.
quote unquote.
We need to do
in quotes.
Yeah, We need to do what is it called? Sensitivity, where you give a little bit of it.
Yeah.
You give him just a little bit of garlic.
Yeah.
And then he's not as allergic to it. Anyway, so Dracula has hematophasic porphyria syndrome.
You're going to have to break that down for me word by word.
All right, so here we go. So here's the primary pathology. Congenital erythropoietic porphyria with behavioral hematophasia.
Okay, can you break that down, though?
Sure, I'll go through it. So the symptoms are extreme photosensitivity. Yeah.
Okay, wait, go back, go back to the word.
The words. Okay.
Because I know, like, in medical terms, right?
So congenital means that he was born with it.
Okay.
Right? So either it's genetic or it was something he was born with.
Congenital.
Erythropoietic.
Erythro is something?
Yeah, erythro. So it's the red blood cells. Right?
So anything erythro is red blood cells.
Yeah.
This is great information. I like this.
ERYTHRO, right?
Erythro.
Yep. So erythropoietin is the chemical in the body that causes the red blood cells to be generated, basically. Okay.
So poetic.
Yeah. Not poetic like poetic.
Oh.
But Poietic.
Poetic.
Uh-huh.
Okay.
And then porphyria is like a blood disorder.
So he has red blood disorder?
Yeah, basically.
Congenital.
Yeah, congenital. So born with it. Red blood disorder.
Okay, which means?
Okay, we'll go through it. Okay. And then there's the behavioral hematophasia. So behavioral.
Yep.
Something he does. Hemato is blood.
Okay.
Phasia is to eat or drink. Behavioral. Blood drinking.
Yeah. So he has behavioral blood drinking.
Right. But he's drinking it. Now we'll talk about it. He's drinking the blood not because he actually wants to drink the blood. He's making up for his lack
of red blood cells.
Yes.
Wow.
Look at this. See? Okay.
This is all making sense to me now.
So he's got extreme photosensitivity, which is why he can't go out at night.
Okay.
Pallor, which means he's like white.
Wait, extreme
photosensitivity.
Yeah.
Sensitive to light.
So he goes out at night.
He can only go out at night. He can't go out during the day. Yeah, I said that back.
Yeah. So he can't go out to drink.
He can't go out during the day. Pallor, so he's very pale.
Yep.
Because no red blood cells. And receding gums, exposing elongated canines because of all the bleeding in the gums. The canines. More pronounced.
Okay.
Classic. This is all classic for porphyria, that blood disorder.
Okay.
Where porphyrin accumulation damages skin upon sunlight exposure. So there are certain types of porphyria, the blood disorder, where if you go out in the sun, it'll actually cause you to burn so badly you get blisters.
Okay. Wow.
Yeah. Chronic anemia from blood aversion led to compulsive hematophasia. So, again, he's anemic.
Yep. So he's short of red blood cells.
Correct. And so he goes and he eats blood to make up for it.
Does he? So he doesn't crave them because of that.
Well, yeah. But he doesn't do it just to be mean. He's trying to replenish his red blood cells.
Okay.
Drinking blood to self-transfuse.
Got it. When you put it like that.
Much better.
Yeah.
So what complications would he have?
Yep.
Hematosplenomegaly, so a big spleen and a big liver because he's intaking so much red blood cells. That has to get processed through the spleen and the liver. Red-tinged urine, because, again, eating blood. And psychotic nocturnal behavior.
Right. So.
Which is why he's crazy.
Up at night.
Yeah, and he's eating people.
Yeah.
Mm-hmm.
Yep. Yeah. It's a vampire.
Yep. From hemosynthesis disruption. So
hemoglobin is blood, right?
So as he's creating the blood,
yep,
it's causing all kinds of byproducts that's making him go crazy.
Wow.
Oh yeah.
So how would you treat somebody like that?
Hematin infusions, so that builds up his red blood cells. Strict photo protection, so long sleeves and hats and masks and all kinds of stuff. And psychotherapy for his nocturnal dependency rituals.
So, but he's still getting.
You'd give him transfusions, yeah.
But how is that different from drinking it?
Well, he's not killing people.
Okay. I mean, yes, obviously, but he's getting it in a safe. He's getting it in a safer manner.
Exactly.
Okay.
And you don't know what kind of infections these.
So we're gonna put it on the screen.
Yes.
Dracula.
Yep.
with,
congenital erythropoietic porphyria.
and you will die. You will
With behavioral hematophagia.
and you will treat him with.
Hematin infusions.
Uh-huh.
Strict photoprotection. And psychotherapy for nocturnal dependency rituals. I have it all written down. I'll send it to you.
Oh yeah.
You can put it under there.
Yeah, I will.
All right.
Okay,
All right.
what's the second guy?
Frankenstein's monster.
Frankenstein. Hold on, Frankenstein.
Now, some people know this, but Frankenstein was actually the doctor who created the monster. So technically, the bolts in the neck thing, that's Frankenstein's monster, not Frankenstein.
Really?
Frankenstein was the doctor, correct.
I'm learning.
Frankenstein's monster didn't have a name.
Frankenstein has staples,
Yeah. Oh, yeah.
and then he has like the
bolts
in his neck.
Okay.
All right, so
All
what are
right.
we diagnosing?
So everybody knows Frankenstein.
Correct.
He's the monster that Frankenstein's monster is the monster that Frankenstein, the doctor, created.
Correct.
He took a bunch of parts from different bodies that he dug out of the ground, put it together, and then used a lightning bolt to. That's why he's got the bolts
Fuse
on his
it
neck
together.
To spark him to life.
Got it.
Yeah.
Okay.
All right. So primary diagnosis.
Yep.
Systemic allograft rejection following composite tissue reanimation.
Systemic what?
Systemic allograft. So an allograft is taking an organ or something from another person and putting it in you, allograft, as opposed to an autograft. So like if you get your ACL done, sometimes they'll take
Tissue
tendons from your own body
Oh, right, down here.
and put it in the ACL. Dr. Adam CN could talk about that. So that's an autograft. An allograft means it comes from somebody else. Okay, so rejection. So we talked about with
Transplant.
correct. Yeah, we talked about with Dave Schrock, transplant, you can get rejection. Following composite tissue reanimation. So what that means is they put all that stuff in and tried to reanimate it, shocked it. So systemic allograft rejection following composite tissue reanimation.
How do you even treat that?
Well, here we go. Let's describe it first and then
Oh,
treatment.
that's right.
Constructed from multiple cadaveric donors. So Frankenstein dug up a bunch of bodies, put it all together into one monster. This patient suffers from chronic immune-mediated rejection.
So
his own body,
his immune system's rejecting him.
is attacking all of the stuff, all the organs and stuff that Frankenstein put in there. Cyanotic skin, meaning that the blood's not pumping, so the skin's blue. Scar hypertrophy, because, all
The scarring.
is bad. And necrotic lesions result from graft vasculopathy.
Say that one again.
Okay, so
Lesions
necrotic
from-
lesions on the skin
Okay.
from graft vasculopathy. So as he starts to reject those organs, there get big clumps of immune cells in the blood, and it basically stops the blood from flowing to certain spots.
Necrotic means dying.
Dying, yeah. So let's say the thumb, right? The blood flow to the thumb is occluded, is stopped by that big mass, and so it starts to die and become necrotic.
Listen, I am not a doctor, and I'm nobody's doctor.
Yeah.
But I'm not terrible at these terms.
Yeah, you're pretty good. Yeah.
I'm not bad.
It's all Latin.
I'm not bad.
All right. Neurologically, the
Oh,
disorganized cortical integration. So because he put a brain in from somewhere else that's not integrated, it's just kind of firing randomly, causes dissonance and emotional dysregulation, which is why he gets so mad.
So dissonance is like disengaged.
Mm-hmm. Yeah, like inability to put things together, basically.
Okay.
Right? So
This is the monster we're talking
this is the
about.
monster, yes. And emotional dysregulation.
What was wrong with Frankenstein himself?
Well, he wanted to play God.
Wow. That's true.
The movie's somewhat funny. It's Robert De Niro plays Frankenstein's
Okay.
monster. Yeah, it's good.
The Robert De Niro. How many Frankensteins are there?
Oh, there's a lot.
There's a bunch.
Yeah.
Yeah.
So, complications. Hyperinflammatory cytokine storm. You remember we talked about this during COVID. So your body recognizes something as foreign and like all your immune system goes crazy.
Okay.
Arrhythmias. Okay, because the heart isn't beating in line with the rest of the body because it's not his heart. and severe insomnia, secondary to cortical overstimulation. So his brain is overstimulated. He can't sleep.
Have you noticed a theme with these first couple? Lack of sleep.
Yeah, true. We should do a whole podcast on sleep. At some
Lack of sleep
Lack of
is a
sleep.
huge thing.
Yep.
And actually, I was listening to somebody, he was a doctor on TikTok
Okay.
when I was scrolling.
Okay.
Of course, you're my biggest,
of course.
the
Yeah,
person
yeah,
that
yeah.
when I scroll, I see you all the time. But now I get other doctors. And he was like, the biggest red flag of any disease or anything is lack of sleep.
Yeah, lack of sleep's not good.
Lack of sleep is horrible.
Yep. Yeah.
And smoking.
And
whatever.
smoking, yes. All right, so treatment.
Yep.
Massive immunosuppression. So all the medications that make your immune system not fight itself, right? Not fight your own body. And then there's a little note here. Everything I read about immunosuppression says it's contraindicated in a corpse. So just
Keeping it lighthearted here on this Hallows Eve.
yeah. Followed by palliative voltage regulation therapy.
Okay.
I don't know exactly what that means, but
Palliative means
palliative means like end of life type care, palliative care.
so voltage therapy.
Voltage therapy, yeah, where
So
they're
you're-
shooting, through the knots on his neck. Yeah,
That doesn't sound like a good
it doesn't
treatment
sound very-
option.
No, it doesn't sound wonderful.
Who's our next victim?
Neither does the massive immunosuppression.
No, not at all.
The werewolf.
Werewolf of London?
It just the werewolf.
The werewolf.
Yeah. Werewolf is kind of a combination of a lot of different stories, but this is Teen Wolf. Michael J. Fox, Teen Wolf.
This is Motionless in White by Werewolf.
oh
This is
my.
the wrong.
All right, yeah.
And then we've got Winnie the Pooh version. Oh, yep, Winnie the Pooh. And then we've got the werewolf song.
Nope.
I
right.
don't know what that is.
So primary pathology.
yes, the werewolf.
Intermittent, meaning not constant, but comes and goes. Hyperandrogenic. So androgen is the male, basically the male hormones, the activating hormones. So hyperandrogenic. Adrenal storm. So the hormones that come from your adrenal glands, epinephrine and norepinephrine, triggered by lunar linked. So moon linked circadian dysregulation, sleep again.
There we go.
Again, yeah.
He's at night,
Yep.
right?
Full moon.
And then all of a sudden turns into a werewolf.
Yeah. So during full moons, the patient experiences extreme hirsutism. That's hair.
Okay.
Okay. Grows a bunch of hair. Hypertrophy. Gets bigger and stronger.
Okay.
Aggression
Yep.
and dissociation. So he doesn't remember. Think of it as a blend between congenital adrenal hyperplasia. So that's basically where the adrenal glands push out too much norepinephrine and epinephrine.
And hyper is just too much, of
much,
something,
yep.
right?
Mania, so you've heard of that, right? Like manic depression, mania. And advanced sleep-wake inversion. So he's awake all night and sleeps all day.
This is a common problem
is.
with monsters.
We should write a dissertation on this.
We should.
Yeah. Okay, so the complications.
Yep.
Rhabdomyolysis. This is like what people get if they run a marathon and they don't train. The muscles start to break down and it can destroy the kidneys. And
Yeah.
you've heard all
I know,
this,
it's
right?
dangerous, yeah.
Rhabdomyolysis. Traumatic injuries that
Okay.
you don't remember because he's out doing whatever. And hypermetabolic shock. So as he comes out of it and all those hormones go away, you can end up in shock.
Boy,
Nifty. All right, so treatment.
that sounds like a bear too.
Oh yeah, continuous ACTH suppression. That's one of the main hormone that would cause the adrenal glands to fire. For his mania, lithium, which nobody uses anymore, and nocturnal confinement. Lock him up all night long.
What? I mean, what's happening? I would feel like those people would go more crazy.
Yeah, you just got to lock him up.
I feel like you
Yep.
just. I don't know if we want to say this on the.
What?
No.
Go ahead.
Go ahead. I feel like we need to put a lot of these monsters in a straitjacket and just put them in their rooms.
At night, they find during the day.
Well, not Dracula.
Well, I know, but he would be if he had like stuff all over him. Yeah.
90 SPF.
Full moon phototherapy trials remain inconclusive. Trying to desensitize him to the full moon.
Werewolves of London.
Oh, there you go. All right. Nice.
That's a good one.
Okay. So the next one is The Invisible Man.
Ooh.
Actually, my kids read this book. They liked it quite a bit.
The Invisible Man. Mm-hmm. This is a song by Queen, too, by the way.
Is it The Invisible Man?
I think so. Yeah. But I'm not sure if... Oh, yeah, this could be. This is The Invisible Man by Queen. I never knew this.
I didn't know this was a song.
I don't think this is the same one.
All right. Fair enough. So induced refractive index alteration via systemic nanochemical infusion.
That's a big one.
All right. So all that means is you can't see him because he injected something into himself that changed the way that the eyes see his skin. So induced refractive index alteration via systemic nanochemical infusion.
Is this a TV series?
No, it was a book.
Oh, it's a book.
Mm-hmm. Yeah.
Okay.
Patient achieved full transparency by matching dermal refractive index to ambient air. So the thing that he took in changed the way that his skin and body reflected light to make it look just like the outside, just like ambient light.
That's crazy.
Yeah. But at a cost of severe epidermal barrier dysfunction.
Okay.
So it means that his skin doesn't work anymore. So he can't protect his internal organs because his skin doesn't work. The result is chronic hypothermia, so he's always cold.
Yep. Hypothermia,
right? Always cold. Dehydration, because he can't keep any water in his body. And sensory deprivation psychosis. So if you've ever heard of sensory deprivation, if you do it for a short period of time, sometimes it can clear your mind. You do it for too long, though, and it causes you to go crazy. Because your brain starts to just make things up if it doesn't have any sensory input.
What would be the healing?
How do we treat this?
Yeah.
Gradual pigment resaturation therapy. So we start to give him melanin, basically, to make his skin go back. Yeah. And psychological grounding techniques in mirrored environments, which is actually cool.
Wow.
So and I used to study this because I did some neurology research. So for people who like lose a limb, they get phantom limb pain.
Yeah,
right.
I've heard that.
You've heard of that. So it feels like it's still there. Say you lost your hand, feels like it's still there. So the way that they treat it is they have this mirrored box, and you put your good hand in the mirrored box and move it around, and it reflects into the other hand, and it makes you feel better.
That is really interesting. I had a 3-legged cat once.
Did you? Okay.
Mm-hmm. And I feel like she
some story there, huh?
Yeah.
Okay. Anyway, that's okay.
But they kind of phantom move their clavicle to
move it,
mimic their arm.
Yeah.
Interesting.
She needed mirror therapy.
Yeah.
Yeah.
Interesting.
Yeah. So that's the Invisible Man.
How many more we got?
One.
Okay.
Yeah.
Which one is this one?
Jekyll and Hyde.
Jekyll and Hyde.
Oh yeah.
Okay, Jekyll and Hyde.
Dr. Jekyll and Mr. Hyde.
Theme? Suppose I should have done this before.
I didn't even know these existed, so.
Let's see. Jekyll and Hyde theme song. This is the moment, apparently.
I hear nothing.
Is this like a high school play?
This must be Jekyll, not Hyde. Hyde would be like...
Soundtrack of the mind.
Okay. So, Dr. Jekyll and Mr. Hyde.
Oh, here it is. Yeah. Okay.
Awesome.
We got to hear the theme suit. Yeah.
All right. So, multiple personality
Correct.
disorder, which is now called dissociative identity disorder.
Yep.
All right. So they have totally distinct personalities, right? So that happens. So
It's the same person.
right, but two separate personalities, and it's super, super rare, right? So like there was like this sort of social contagion in the 80s and 90s where people were like, oh yeah, I have multiple personality disorder. Super rare. But people who have it, they completely dissociate from the other personality. So with unique moral codes, behaviors, and even physical characteristics. Memory gaps. So one personality doesn't remember what the other one did.
Sure.
Okay. Stress-related triggers, which is normal in multiple personality disorder, DID. So, you get into a stressful situation, and instead of coping with it, your body flips on one of those other personalities. And functional impairment. So the dual existence causes personal, social, and ethical collapse, culminating in, ultimately, he killed himself. Suicide. Yeah. So there's some other things that maybe could have been substance abuse, substance-induced psychotic disorder. He was testing a bunch of drugs on himself. He was a chemist. Antisocial personality, or maybe bipolar. Maybe not. So how do we treat him? All right, so medications typically discontinue any experimental substances like his potion.
Okay.
Took his potion to, and provide a safe environment. And then psychotherapy, particularly cognitive behavioral therapy, where you talk through, what caused this, what are you dealing with, all that sort of stuff. And then there are really no drugs for DID, but usually what people do is give some sort of antipsychotic for this. And then really what they do is they try to get the personalities to integrate.
Okay.
Once they learn about each other, sometimes that can help them basically reform into one personality.
So this is the biggest question for you.
Uh-oh.
If you had to treat one of them, what would you treat and why?
That's a good question. I have to look through which ones. Probably the werewolf.
Really?
Yeah, because he's normal during the day.
Um,
All I got to do is chain him up at night and inject him with some ACTH.
Sounds simple enough.
ACTH suppressors.
The most difficult ones, and the Invisible
Man would be tough, and Jekyll and Hyde would be really tough.
and Jekyll and Hyde, they're not necessarily night creatures, right?
Correct,
They're
yeah.
not only at night
Correct. Yeah.
situations.
Yep. I say werewolf.
The werewolf,
Yep.
that's the one
That's
you
what I
would treat.
Yep. Yeah.
This is really interesting.
Yeah.
Here's why I really like this segment. Not because of the music.
Clearly.
I'm just here for the music.
Yeah.
I think the vocabulary really helps,
Oh, yeah.
right? Like the
Yeah.
breaking down of each thing.
Yeah.
And it not only, contributes to learning more vocab when we're talking, but I feel like it helps regular people break down what things mean.
Yeah. It's all Latin. I mean, almost all of medicine is Latin. So, once you I took Latin in grade school and middle school, but once you kind of break it down, you learn like hypo means low, hyper means high, like that sort of stuff. You can get a sense of what everything means. But no, this is fun. And so, the monsters in literature was kind of the impetus for this. There's a movie out that I really like called The League of Extraordinary Gentlemen.
Sure.
Which is based on a lot of these. It's Jekyll and Hyde's in that, and the Invisible Man's in that. It's also Captain Nemo.
Is that Sean Connery?
Yeah, he plays
Sean Connery.
I can't remember who he plays. He's the guy who found Solomon's I can't remember who it is. Anyway, it's a cool little story. So I like horror movies. I particularly like classic monsters and books and stuff. So this is fun. I figured it was a good one for Halloween.
Happy Hallows Eve.
Happy Hallows Eve,
my friend. Always good to chat with you. And
what are you going for Halloween?
You want me to give it? I guess the podcast will come out on the 30th.
Yeah, the day before.
So I won't be giving anything away really, but maybe I will.
You don't have to.
Maybe I will.
I always drive the truck that the kids ride in, so I don't really dress up.
You have a mask?
I do, but
do you want to know?
No,
we'll be
I'll
at your house.
I'll wait. Yeah, I'll wait.
You don't want to know?
No, I'll wait.
It's really funny.
We'll talk about it next week.
It's actually based off of my 1-year-old son.
Oh, nice.
We found something for him
And you, yeah.
And we're all
nice.
working around him to be the family, I guess.
We found, and he's not
Not a
going to
family.
wear it, but my younger son, we found a toilet that had poop all over it, like a blow up. We were going to have him wear, but he wouldn't do it. So I don't know what
That would've been funny.
I don't know what my kids are going as yet. But
Actually, that would be hilarious.
It would
if
be.
we went as I went as a Japanese toilet, and he went as
with a bidet in it.
yeah, with the water and
Yeah, Tushy. Tushy.
the
Tushy
Tushy.
bidet.
What up, Tushy?
What's up, Tushy? Yeah.
What are you going? You're just putting the
I
mask
just drive
on.
the I put the mask on and drive the truck.
Nice.
Yeah.
You're going to be pleasantly surprised as to what I am
great.
next week.
I'm excited.
It's going to be fun. It's all going to be great fun.
Yeah.
Thank you.
Hopefully everybody enjoyed the episode. Little different than our typical episode, but
I love it.
Yeah.
It'll probably be our most viewed and listened to.
yeah, exactly.
podcast.
Do that instead of all the real stuff you guys talk about.
The Butterfly Network is our sponsor. They are certainly not scary. We appreciate you sponsoring the podcast, and we appreciate you listening. Happy Halloween.
Happy Halloween.
Mr. Dr. Brian Schmutzler. We'll see you in the next one.